line with us is the first whistleblower on the COVID pandemic way back last year, the epidemiologist and senior fellow with the Federation of American Scientists, Dr. Eric Feigl-Ding, formerly a faculty member and researcher at the Harvard Medical School and Harvard's T.H. Chan School of Public Health. Dr. Eric Ding, D-R-E-R-I-C-D-I-N-G is his Twitter handle. And if you're not following him on Twitter, you need to get over there. Dr. Feigl-Ding, welcome back to the program. Number one, what's the latest that we know about Omicron or Omicron, and how do you pronounce it?
Thanks. I think it's the Omicron, and I think right now the data is still early, but there's a lot of signs that not only cases are rising much, much faster than any other previous wave in South Africa. It's literally shooting through any of the previous curves. But it also, hospitalizations are also rising, and rising fast. Like, for example, just last week on Friday, we knew that cases have, in 2 weeks, have increased tenfold. So 10x increase in hospitalizations from the 2 weeks prior.
Is that 1,000% if I'm doing my math right?
Yeah, 1,000% compared to what was 2 weeks ago.
Right.
And that was because originally it was 3x, and then because of backfilling of hospitalizations, it went up 10x. So the hospitalizations are surging too. Now the question is, well, some people say, well, it's milder. The hospitalization is surging less steeply than the cases, but we have to think that South Africa is now more vaccinated than its previous waves. South Africa is younger than the U.S. in many ways, and so it's most young people who are being infected, most infected, and most hospitalized because they're less vaccinated. So in many ways, the proponents who say it's milder are ignoring the fact that it's younger people. So yes, it's compared to the U.S., the hospitalization rate is lower because it was younger cases. And now it's also more vaccinated. And the other thing that they point out, deaths have not risen yet, but deaths usually lag by several more weeks. So we still have yet to figure that out. And of course, with the Omicron, we think that there is some sort of evasiveness against vaccines to some degree that allows it to spread faster. So we have to still be very vigilant.
Yeah, well, and I'm guessing, 2-3 weeks before we really start seeing in the United States Omicron cases going from diagnosis to hospital to death, and start being able to actually do those calculations and figure out what percentage of those people were vaccinated and how much, or not at all, or all that kind of stuff.
Yeah, and so right now the epicenter clearly is South Africa, Gauteng province, which includes Johannesburg, Pretoria, and whatnot. But it is spreading worldwide. It is in dozens of countries now worldwide. And we know, of course, the travel bans have been very frustrating. But I think in certain ways, it's not the travel bans we need. We need border entry testing that U.S. still has not instituted yet. U.S. just shortened, for example, the pre-flight testing from 3 days to 1 day, but we need border entry testing critically, and repeat testing, because that's how they catch these cases.
What other countries are doing that?
Well, Hong Kong is doing that. A lot of the Asian countries do that. Australia and New Zealand are doing that, and they're adding border quarantine as well. But for Europe, for the most part, doesn't do that. And U.S., of course, doesn't do that either. And that's, in certain ways, it's so leaky. You have to have arrival testing. Because if you don't have arrival testing, you have, like, for example, Norway, the Christmas party. There was 100 people at the Christmas party. The vast majority, like 70 people, got infected at the Christmas party. And everyone had tested negative and were vaccinated before that. But obviously, they didn't test positive until several days later. One of them had South Africa travel and brought it there. So if you didn't have this repeat testing and quarantine, you wouldn't be able to stop these kind of outbreaks. And of course, they were all tested and vaccinated, which shows that we need to repeat test and that we need boosters. We think boosters will help, but we are not sure in terms of the exact efficacy of 2 shots. People many scientists are saying it's much, much lower than before. We don't have the exact number yet, but they're pretty certain that the efficacy against infection is much lower than before. Hospitalization will hopefully still hold up okay, but that's why we really need boosters.
We've got a dozen or so of the rapid test kits floating around the office here. I was buying them back when they were available on Amazon. And excuse me, no, I don't have COVID. I just inhaled some saliva. And I've been thinking of them as, well, let me set this up. The PCR tests, you know, the official tests, the fancy tests you go to a testing center or a hospital for, amplify the DNA test for the presence of the virus. These home tests are antigen tests. In other words, they're looking for proteins that your body produces as part of its effort to fight off this virus that are specific to this virus. Correct me if I'm wrong on any of that. Do I have that right so far?
Not exactly. So the rapid antigen tests for, it's an antigen that tests for proteins on the virus. So it tests for example, the nucleocapsid protein of the virus. So it's actually testing for live virus.
Oh,
While
interesting.
the PCR tests for the RNA genetic material of the virus. But that can also include the genetic material from a dead virus, too. So after a virus has already been killed off and then you have fragments, the fragments can still test positive. People were very frustrated for the longest time. So it's so in certain ways, a PCR can test for lower amounts, but it also tests for dead virus.
Yeah, well, where I was going with that.
Rapid antigen specifically tests for live virus.
Right.
You can't test positive until live infectious virus.
Yeah, where I was going with that is I've been thinking of these as the PCR test being, you know, are you infected or have you been recently infected or whatever, you know, super gold standard test. But that the rapid tests that you can buy in the drugstore or online, that those rapid tests really, if you wanted to narrow it, you could say most accurately will definitely give you a positive signal if you are contagious, if you have the disease to the point where you're starting to actually produce viruses and expel them. Is that a reasonable way to think of them?
Yes, I think it's mostly reasonable the way to think of them. Yes, the PCR is kind of more bigger net, but it also catches more non-infectious, while the rapid antigen catches definitely the big virus fishes, but occasionally it can also miss a few cases of lower viral load.
Right, which would be early infection.
Between.
Yeah.
But between what I prefer is, you know, if you're trying to drop sonar buoys to find a hidden enemy submarine, do you want to drop it every 10 miles or try to find it, or do you want to drop it every mile, every kilometer, and be able to find it, you know, 85, 90% of the time? I would rather drop my sonar buoy every mile to try to find it. That's greater chance.
Which is the home tests, right?
Yeah, which is the home rapid test.
So what does this tell us about Christmas? I mean, should we? I've got enough, COVID tests at home that if I invite family or friends over for Christmas, I could ask everybody to just, sit in the bathroom for 15 minutes and test yourself. Or is that, over the top hysteria?
I don't think it's over the top. I think it's very precautious. I think it depends. Is everyone boosted? Because we know that with vaccine waning, that a booster really, really helps. So we're increasing in protection against infection and hospitalization back into the 90s. Or else without a booster, your waning has, after 6 months, can easily wane to 60%, 50% efficacy against infection. And hospitalization can wane to the mid-80s to low 80s. But with a booster, you get both numbers back into the 90s. And that's why it's so critical. And then if everyone's boosted, like everyone in my family is, and then the testing, it's still precautious and you should do it. But if you're not boosted, testing definitely is very, very critical.
Right.
And I would have them test the day before and upon arrival at the party, because some people's tests could be like a day or two old.
I know some folks in Hollywood who just do this. I mean, they've got a part of their house where people have to go and sit and wait while their 15-minute test is processed, and they've been doing it for 6 months or more. We're running really tight on time here. I'm curious. Two last questions. Number one, What do you think of Mayor de Blasio's vaccine mandate for all businesses in New York City? And number two, when should we expect these pills to come onto the marketplace that might help people early on in a COVID infection?
So I think the vaccine mandate is good. My actual concern and the criticism these days is that these fully vaccinated should be defined as 3 shots, not just 2.
Right.
2 shots is not enough in the face of Omicron and also vaccine waning. 3 shots triples your antibody levels. It's really critical that you get the booster. Please, everyone, get a booster. And I think, going forward, you really, really need to be vigilant against Omicron. I cannot stress enough. And I think that for Christmas, if you're not protected with 3 shots, please, you should not consider yourself fully protected as Omicron is growing.
Right. And when do you expect the antiviral pills will become available?
Well, I don't think the drugs are that important. Like the monopiravir, by the way, the efficacy is only 30% instead of 50%. Mm-hmm. And there's also concern about whether they cause cancer because they're mutagenic. Their function is to cause cancer and mutations. And there's hot debate about, and I think, these treatment drugs will prevent you from going to the hospital to some degree, 30% lower risk, but they're not like 80, 90% as effective as vaccines. And again, they carry some cancer risk and they're expensive. And so even if they're coming out soon, the Merck one, I do not think it's going to be able to slow down the pandemic per se.
Right. But the monoclonal antibodies are still first line if somebody gets an infection.